Hi, today we'll be focusing on the psychology of addiction. But before we delve right into our main topic, let me first introduce you to a general idea of how addiction really works within our body. Our brain and nervous system is composed of fundamental units called neurons. Neurons are basically the wiring of our body, receiving and releasing signals essential for the functioning of our bodies. There's a connection point from one neuron to another called the synapse. Chemical signals travel through the synaptic cleft in the form of neurotransmitters. These neurotransmitters are often called the body's messengers as they release information, influencing how we feel, cognition, and so much more. Some examples of neurotransmitters include adrenaline, serotonin, and dopamine. All of these neurotransmitters have their functions in the brain, managing everything from our breathing to our heartbeat to our learning and concentration levels. They can also affect a variety of psychological functions such as fear, mood, pleasure, and joy. Some drugs can mimic that of a natural neurotransmitter, affecting the rate of activation receptors. When it comes to addiction, a main neurotransmitter is dopamine. Dopamine plays a role in how we feel pleasure. For example, dopamine is released through eating a favorite food, sexual intercourse, or an enjoyable snack. This is why people that take a drug such as cocaine feel the pleasure due to a drug mimicking dopamine. Cocaine and other drugs alike can block dopamine reuptake pumps, causing a high in dopamine levels. Additionally, cocaine cuts back on dopamine receptors, and fewer receptors result in normal pleasure signals to weaken. This explains the cause of addiction and the agony of withdrawal. Alright, now that we have gotten a quick overview on the biochemistry of substance abuse and addiction, let us have a look at psychological disorders that can lead a person to become more susceptible to addiction. One such disorder that we have touched on in our class is post-traumatic stress disorder, or PTSD. This is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Some symptoms may include flashbacks, nightmares, severe anxiety, as well as uncontrollable thoughts about the event. People with PTSD are prone to violent outbursts and panic attacks, which can be difficult for family members and friends. These feelings of guilt as a result of these outbursts can lead a person with the disorder to seek self-medication, in turn leading them down the trap of addiction. A survey conducted among adolescents receiving treatment for substance abuse have shown that more than 70% of patients had a history of trauma exposure, and 20% of people who experience a traumatic event will develop PTSD. All in all, traumatic events can lead a person more vulnerable to alcohol or drugs as they can utilize its side effects as a coping mechanism. Self-medication can suppress psychological afflictions characterized through the form of anxiety attacks, bad memories, guilt, shame, and terror. Of course, there are other mental illnesses that can leave a person more susceptible to addiction. Some mental disorders include schizophrenia, obsessive-compulsive disorder, bipolar disorder, and so much more. Let us also examine the psychological disorder of schizophrenia. In definition, schizophrenia is characterized by disorganized thinking, emotions, and behaviors that are incongruent with their situation and disturb perceptions of reality, including delusions and hallucinations. People diagnosed with schizophrenia even have a 50% rate of developing addiction than among the general population, with alcohol, nicotine, cocaine, and marijuana as the most commonly abused legal and illegal drugs among patients with schizophrenia. So what do these mental illnesses really have in common regarding their susceptibility to addiction? Well, substance abuse is a non-constructive coping mechanism that can suppress psychological hardships and is often perceived as an escape from the adverse effects of mental illnesses. It is also worth noting that the influence of addiction can be attributed as 50% genetic, and the other 50% is the influence of one's environment. However, having a predisposition does not mean that addiction will manifest in a person with 100% certainty. These genes only subject a person's susceptibility to external factors, but with the right mindset, psychological awareness, and our social behavior is really the main factor that determines our susceptibility to addiction. So, as for my personal research, I interviewed my father, whom in his youth has met many people who have been exposed to and even experienced addiction. One of these people was his own cousin Bobby. My father explained to me that he was a straight-A student, but just like many, the introduction of drugs changed his life forever. He was introduced to drugs in the form of cocaine and marijuana through his environment and the people he surrounded himself with. This goes to show how big of an influence our social environment has on our psychology. particularly our cognition, our behavior, and our ability to make right choices. What interests me is one conversation he had with my father. He mentions, Gio, promise me something, will you? Don't be like me. Don't ever do drugs. This simple statement from Bobby astonishes me as it shows that he does recognize the negative effects of drugs in his life, but yet he still continues to do it. His cognitive understanding recognizes that it is bad for him, but his body says otherwise. Bobby's experience can be attributed an example from the bridge between psychology and the biochemical effects of addiction. It shows how the process of chemical messengers through neurotransmitters and brain activity/signals can affect a person's health and mental behavior. Some behaviors he shows is fidgety, restlessness, paranoia, anxiety, depression, helplessness, and so much more. Unfortunately, serving a sentence in prison for his drug history, he unfortunately passed away 2 years ago, but he sets an example of how he escaped psychological and physiological traps of addiction. He escaped addiction and healing his mental state through God. Thank you.